You've probably heard someone say, "Don't worry, it's a routine surgery." But then you wake up afterward and your breathing feels shallow, coughing hurts, your chest feels tight, and your mind feels a little foggier than you expected. After 25 years in medicine, I've seen firsthand that for adults over 65, it's often not the procedure itself that causes the biggest setback. It's what happens to your lungs and oxygen levels in the first 24 to 72 hours. But what if I told you there's a simple 2-minute trick you can do before your next surgery that can dramatically lower the odds of that downhill slide? In the next 9 minutes, I'm going to walk you through exactly what to do, why it works, and how to make it automatic so you use it even when you're sore and groggy. Here's the part almost nobody explains clearly. Many post-operative complications don't begin in the operating room. They begin quietly afterward, when breathing gets shallow and staying still feels safer than moving. I call it the cascade effect. Picture a row of dominoes. Domino 1. Anesthesia and pain make you take smaller breaths. Domino 2. Smaller breaths don't fully open the bottom of your lungs, like a sponge that never gets stretched open. Domino 3. Mucus sits there, oxygen drops, and your heart has to work harder to deliver the same fuel. And then the consequence hits. You feel weak, you move less, you cough less, and lung complications become much more likely. Maybe you've seen this in someone you love. They do fine the day of surgery, then on day 2, they're suddenly exhausted. They avoid coughing because it hurts. They rest more and more, and their lungs get less and less air. Here's what most people don't realize, that well-meaning rest can feed the cascade. Let me give you a quick scenario. A 74-year-old woman, let's call her Patricia, goes in for a hip replacement. The surgeon says everything went beautifully. The family relaxes. But the next morning, Patricia is guarding her incision, breathing shallow and skipping coughs because she doesn't want to make a fuss. By day 2, she needs oxygen. By day 3, she's barely eating, sleeping poorly, and her family says she's just not herself. That's often not normal aging. That's the cascade. Small breaths, lower oxygen, less movement, weaker cough, more mucus, higher pneumonia risk, slower recovery. Stay with me because the solution is simple, but there's one common mistake that makes it useless. To understand why this matters after 65, let me show you the 2 ways this cascade hits harder. Number 1, it steals oxygen right when your body is trying to heal. Healing is oxygen hungry. Your incision, your muscles, your immune system, everything runs better with steady oxygen. Number 2, it raises the risk of post-operative delirium, confusion that families often call hospital brain. Researchers at Harvard Medical School have warned that delirium in older adults after surgery is common, and it's associated with faster cognitive decline in research settings. So here's the tension. You can have a technically perfect surgery and still feel like you never bounced back, simply because breathing and oxygen weren't protected. Now, here's what actually works, and it's surprisingly simple. For decades, we were told, just rest before surgery. Save your energy. That's wrong. What you want instead is a small, safe training signal that builds reserve, so surgery can't knock you below the line where complications begin. The research is clear on this. In studies from institutions like University Medical Center Utrecht, strengthening breathing before surgery has been linked to fewer post-operative lung complications, including pneumonia. But you don't need to memorize papers. You just need a routine. Today, I'm going to walk you through 3 steps. Step 1, the 2-minute lung primer, once per day starting today. Set a timer for 2 minutes. Sit tall in a chair, both feet on the floor, shoulders relaxed. Put one hand on your belly so you can feel the movement. Then do this exact breathing pattern. Inhale through your nose for 4 seconds, letting your belly rise. Hold for 2 seconds. Exhale slowly through pursed lips for 6 seconds, like you're gently blowing through a straw. Repeat until the timer ends. Then finish with 1 supported cough. Hold a small pillow or folded towel gently against your abdomen and cough once or twice. Not aggressive, just enough to practice clearing mucus. Why it works in plain language. Deep, controlled breaths open the lower lungs, improve oxygen exchange, and train breathing muscles that anesthesia tends to weaken. Micro promise. In a moment, I'll show you how to use this after surgery in a way that doesn't hurt and doesn't make you lightheaded. Now, here's where people get confused. They hear breathing exercises and they start taking huge, fast breaths. They get dizzy. They quit. Don't do that. Your goal is steady, comfortable, repeatable breathing. If 426 feels too long, use 315. Inhale 3 seconds. Hold 1. Exhale 5. Same shape, more doable. Step 2. The 60-second second heart pump. Daily, especially if you sit a lot. This supports circulation, which matters because surgery plus stillness makes the body sluggish. For 60 seconds, pump your ankles. Lift your toes up, then press them down, like tapping a gas pedal. Aim for about 30 to 40 pumps. Practical tip: do this immediately after the lung primer so it becomes one combined habit. But here's what might surprise you. This tiny movement is often the difference between "I feel stuck in bed" and "I can stand up without feeling wiped out." Step 3. The 3 questions that prevent avoidable setbacks. Now, before we continue, let me tell you something important. A perfect breathing routine won't help if a medication mistake or preventable side effect derails your recovery, so write these down and bring them to your pre-op appointment. 1. Which of my medications and supplements should I stop, and exactly when? 2. What's your plan for constipation and nausea after surgery? 3. How do you screen for and prevent delirium in patients over 65 here? That third question forces a proactive plan: sleep protection, hydration, early movement, and making sure you have your glasses and hearing aids. Pattern interrupt. Listen closely. If you only remember one line from this entire video, remember this: small breaths create big problems after 65. And 2 minutes of daily lung training can be the difference between "I bounced back" and "I never felt the same." Now, let's close the open loop. How do you use the 2-minute trick after surgery when you're sore? Here's what I tell my patients. Instead of trying to cough hard, you do the breathing first, slow and controlled. Then you use the pillow support, and you cough gently once or twice. That's it. Now, here's where people get confused again. They wait until they feel congested. Don't wait. The goal is prevention. Open the lungs before mucus settles. A simple target is 3 rounds per day after surgery: morning, afternoon, evening. Once your care team says it's safe, that's only 6 minutes total. Let's make this practical and store simple. When you're shopping, look for one small pillow you can dedicate to recovery and set a phone reminder that says 2 minutes, lungs. Motivation is unreliable. Reminders are reliable. If you live with someone, ask them to be your breathing buddy for 1 week before surgery. Not to nag you, just to keep it consistent. Now, for practical application. Morning. Do the 2-minute lung primer before coffee. Then drink a full glass of water, unless your doctor has restricted fluids. Evening. Do the 60-second ankle pumps. Then do 5 minutes of easy walking inside your home, focusing on upright posture. If you can't walk safely, try seated marching for 60 seconds instead. One knee up, then the other. One advanced option, only if your surgeon approves, is an inspiratory muscle trainer device or a simple protein shake. For many older adults, a shake with about 20 to 30 grams of protein once per day for the 2 to 4 weeks before surgery can help support strength. If you have kidney disease or other conditions, your doctor should personalize that advice. Now, some people ask me, what if my surgery is next week? Is this too late? No. Even a few days of practice makes the routine familiar, so when you're sore and tempted to breathe shallow, you'll know exactly what to do. Here's what I see in my practice. The patients who prepare the basics, breathing, circulation, and simple movement, recover with fewer surprises. The goal at age 65, 75, or 85 isn't just to live longer. It's to live better, with independence, with dignity, with joy. Start small. Commit to the 2-minute lung primer once per day starting today. If this was helpful, hit that subscribe button and share this with someone you love who has a procedure coming up. Thanks for watching. I'm Dr. Mark Westfield, and I'll see you in the next one.